If you are over 65 and you frequently wake up with numb, tingling, or painful hands, please do not brush it off as sleeping in the wrong position. Doctors are now warning that this symptom, which millions of seniors experience on a regular basis, can sometimes be a sign of a serious underlying condition that needs medical attention. While it is true that sleeping with your arm under your pillow or your wrist bent at an awkward angle can temporarily compress a nerve and cause numbness, when this happens frequently or does not resolve quickly after you wake up, your body may be trying to send you a critical message. And today, I am going to explain exactly what that message might be, why it matters so much after 65, and what you need to do about it. So please stay with me through this entire video because the causes of morning hand numbness range from easily treatable to potentially dangerous, and you need to know the difference. Imagine waking up at 3 in the morning with your hand completely numb. It feels like dead weight, and no matter how much you shake it, the feeling does not come back right away. When sensation finally does return, it comes with an intense tingling, almost like pins and needles, that can be quite painful. Maybe this happens a few times a week, or maybe it happens every single night. You have gotten used to it, and you figure it is just one of those things that comes with getting older. But let me tell you why neurologists, rheumatologists, and other specialists are paying close attention to this symptom in their senior patients. Because the causes are not always as simple as a pinched nerve from sleeping wrong. I am Dr. Charles Anderson, and today I am going to walk you through the most common and the most concerning causes of morning hand numbness in seniors. I will explain the warning signs that distinguish a minor issue from a serious one, share the tests your doctor might use to diagnose the problem, and give you practical steps to reduce nighttime numbness and protect your hand and nerve health. Let us dive right in. The most common cause of nighttime hand numbness in seniors is carpal tunnel syndrome. Carpal tunnel syndrome occurs when the median nerve, which runs through a narrow passageway in your wrist called the carpal tunnel, becomes compressed or squeezed. This nerve controls sensation in your thumb, index finger, middle finger, and part of your ring finger. When it is compressed, you experience numbness, tingling, and sometimes burning pain in these fingers. The reason carpal tunnel symptoms are often worse at night is that many people sleep with their wrists flexed or bent, which narrows the carpal tunnel and increases pressure on the nerve. Additionally, fluid can accumulate in the wrist area during the night due to the horizontal position of your body, which further increases the pressure. Carpal tunnel syndrome becomes more common with age for several reasons. The tissues in the carpal tunnel can thicken and stiffen over time. Conditions that are common in seniors, such as diabetes, thyroid disorders, and arthritis, can all contribute to carpal tunnel compression. And changes in fluid balance that come with age and with certain medications can exacerbate the problem. The good news is that carpal tunnel syndrome is very treatable. Wearing a wrist splint at night that keeps your wrist in a neutral position can provide significant relief for many people. Anti-inflammatory medications, corticosteroid injections, and physical therapy exercises can also help. And for more severe cases, a simple surgical procedure to release the ligament that forms the roof of the carpal tunnel can provide permanent relief. The key is not to ignore the symptoms and let them progress, because over time, untreated carpal tunnel syndrome can lead to permanent nerve damage and muscle wasting in the hand, which can seriously impair your ability to grip, pinch, and perform fine motor tasks. But the real danger begins when hand numbness is caused by something more systemic. The second major cause I want to discuss is peripheral neuropathy, which is damage to the peripheral nerves throughout your body. Peripheral neuropathy is extremely common in seniors and has many possible causes, with diabetes being the most frequent. If you have diabetes, even well-controlled diabetes, the high blood sugar levels over time can damage the small blood vessels that supply your nerves, leading to nerve damage that typically starts in the feet and hands. Diabetic neuropathy usually affects both hands and both feet in a pattern that doctors describe as a stocking and glove distribution. If you are experiencing numbness in both hands, especially if you also have numbness in your feet, and especially if you have diabetes or prediabetes, this pattern strongly suggests peripheral neuropathy. But diabetes is not the only cause. Vitamin B12 deficiency is another very common and important cause. As we age, our body's ability to absorb B12 from food decreases, and many common medications, including metformin for diabetes and proton pump inhibitors for acid reflux, can further reduce B12 absorption. B12 deficiency can cause nerve damage that manifests as numbness, tingling, and burning in the hands and feet, along with balance problems, memory issues, and fatigue. The good news is that B12 deficiency is easily detected with a blood test and easily treated with supplements or injections. But if it goes undiagnosed and untreated for too long, the nerve damage can become permanent. Other causes of peripheral neuropathy include kidney disease, liver disease, certain autoimmune conditions, alcohol use, and exposure to certain toxins and chemotherapy drugs. The third cause is cervical spondylosis, which is arthritis of the neck. The cervical spine contains the spinal cord and the nerve roots that branch out to supply your arms and hands. As we age, the discs between the vertebrae and the neck can degenerate, bone spurs can develop, and the spinal canal can narrow. When these changes compress the nerve roots, you can experience numbness, tingling, pain, and weakness in your arms and hands. If your hand numbness is accompanied by neck pain, pain that radiates down your arm, weakness in your hand or arm, or difficulty with fine motor tasks, cervical spondylosis should be considered. Treatment can include physical therapy, anti-inflammatory medications, corticosteroid injections, and in some cases, surgery. The fourth cause is thoracic outlet syndrome. The thoracic outlet is the space between your collarbone and your first rib, and nerves and blood vessels that supply your arm pass through this space. If they become compressed, you can experience numbness, tingling, pain, and even coldness or color changes in your hand and arm. This can be caused by poor posture, particularly the forward head and rounded shoulder posture that becomes more common with age. Physical therapy is often very effective for this condition. The fifth cause is cardiovascular-related numbness, and this is perhaps the most serious cause on this list. In some cases, numbness or tingling in the hands can be related to reduced blood flow caused by cardiovascular problems. Peripheral artery disease can affect the arteries that supply the arms and hands. Raynaud's phenomenon, where the small arteries in the fingers spasm and restrict blood flow in response to cold or stress, is another vascular cause. And in rare but serious cases, numbness or tingling in one hand can be a warning sign of a transient ischemic attack or mini-stroke, particularly if it comes on suddenly and is accompanied by weakness, difficulty speaking, vision changes, or confusion. If you experience sudden numbness in one hand, along with any of these other symptoms, call emergency services immediately. The sixth cause that I want to mention is medication side effects. Many medications commonly taken by seniors can cause or worsen numbness and tingling in the hands. These include certain cholesterol-lowering drugs, some blood pressure medications, certain antibiotics, chemotherapy drugs, and even some over-the-counter medications when used long-term. If you notice that your hand numbness started or worsened after beginning a new medication, mention this to your doctor. It may be possible to switch to an alternative medication that does not have this side effect. The seventh cause is autoimmune conditions. Diseases like rheumatoid arthritis, lupus, and Sjogren syndrome can all affect the nerves and cause numbness and tingling in the hands. These conditions are more common in women, but can affect anyone, and they can develop for the first time in the senior years. If your hand numbness is accompanied by joint pain, dry eyes, dry mouth, skin rashes, or other systemic symptoms, an autoimmune condition may be contributing to the problem. Now, let me share some practical strategies for reducing nighttime hand numbness. The first strategy is to wear wrist splints at night. These are available at most pharmacies and keep your wrists in a neutral position, reducing pressure on the median nerve. Many people find relief within just a few nights. The second strategy is to adjust your sleeping position. Try to avoid sleeping with your arms under your pillow or your wrists flexed. Sleep with your arms at your sides or resting on a pillow in front of you. The third strategy is to do gentle hand and wrist exercises before bed. Simple exercises like making a fist and then spreading your fingers wide, rotating your wrists in circles, and gently stretching can help improve blood flow and reduce nerve compression. The fourth strategy is to address any underlying conditions. If you have diabetes, keeping your blood sugar well controlled is essential. If you have thyroid disease, making sure it is properly managed can help. If you are low in vitamin B12, supplementing can address the deficiency before permanent damage occurs. The fifth strategy is to pay attention to your posture during the day. Poor posture, particularly at a desk or while using electronic devices, can contribute to both cervical spine problems and thoracic outlet syndrome. Try to keep your head aligned over your shoulders rather than leaning forward, and take frequent breaks to stretch your neck, shoulders, and hands. The sixth strategy is to stay physically active. Regular exercise improves circulation, supports nerve health, and can help prevent or slow the progression of many conditions that cause hand numbness. Walking, swimming, and gentle yoga are all excellent options for seniors. I also want to address when you should see a doctor urgently about hand numbness. You should seek immediate medical attention if the numbness comes on suddenly, affects one side of the body, and is accompanied by facial drooping, speech difficulties, severe headache, or confusion, as these could be signs of a stroke. You should also see a doctor promptly if the numbness is getting progressively worse, if you are losing strength in your hand, if you notice muscle wasting, if there are color changes in your fingers, or if you are developing numbness in your feet as well. For less urgent but persistent hand numbness, make an appointment with your primary care doctor. They can perform a physical examination, order blood tests to check for diabetes, thyroid disease, vitamin deficiencies, and other possible causes, and refer you to a neurologist if needed. A nerve conduction study can help pinpoint the problem and guide treatment decisions. Additionally, imaging studies, like an MRI of the cervical spine, can help identify structural causes of nerve compression. Let me also talk about the emotional impact of chronic hand numbness, because this is something that often goes unaddressed. Your hands are central to your independence and quality of life. When they do not work properly, it affects everything from buttoning your shirt to writing a check to holding your grandchild's hand. The frustration and fear that come with losing hand function can be significant, and many seniors feel isolated in their struggle because they assume there is nothing that can be done. I want you to know that this is almost never true. Modern medicine has a wide range of treatments for the conditions that cause hand numbness, and for most people, significant improvement is possible. But it starts with getting evaluated. Do not accept hand numbness as an inevitable part of aging. It is your body communicating with you, and it deserves a response. One more thing I want to mention is the importance of regular health screenings for seniors. Many of the conditions that cause hand numbness, such as diabetes, thyroid disease, vitamin deficiencies, and cardiovascular problems can be detected early through routine blood work and physical examinations. By staying up to date with your health screenings, you can catch these conditions before they cause nerve damage and other complications. Prevention is always better than treatment, and early detection is the next best thing. I also want to share some information about emerging treatments for peripheral neuropathy that are giving researchers hope. While there is currently no cure for most forms of peripheral neuropathy, several promising approaches are being studied, including nerve growth factor therapy, stem cell treatments, and new medications that may be able to regenerate damaged nerves. In the meantime, the most effective approach remains addressing the underlying cause of the neuropathy, managing symptoms with appropriate medications, maintaining physical activity, and protecting the hands and feet from injury. If you have peripheral neuropathy, working with a neurologist who specializes in this condition can help you access the most current and effective treatments available. I want to leave you with this message. Your hands are among the most important tools you have. They allow you to feed yourself, dress yourself, hug your loved ones, pursue your hobbies, and maintain your independence. When numbness threatens the function of your hands, it threatens all of these things. Do not accept nighttime hand numbness as just a part of aging. In many cases, it is a treatable symptom of a treatable condition, and the sooner you address it, the better the outcome is likely to be. You deserve to wake up in the morning with hands that work properly and feel normal. And for most people, that is absolutely achievable with the right diagnosis and treatment. If this video has been helpful, please subscribe to this channel and share it with anyone who deals with morning hand numbness. I am Dr. Charles Anderson, and I will see you in the next video. Take care of those hands, and take care of yourself. There is one more area I want to explore with you before we end today, and it has to do with the fascinating and sometimes frightening connection between hand numbness and your overall nervous system health. Your peripheral nerves are like an incredibly complex electrical wiring system that connects your brain and spinal cord to every part of your body. When the wires that lead to your hands start malfunctioning, it is often a sign that something is affecting the wiring system more broadly. This is why doctors do not just look at your hands when you come in with numbness. They look at the whole picture: your medical history, your medications, your lifestyle, your other symptoms, and your laboratory results. They are trying to understand whether the numbness is a local problem, like carpal tunnel syndrome, or a sign of a more widespread condition that needs a different approach to treatment. Think of it this way. If one light in your house flickers, it might just be a loose bulb. But if several lights start flickering throughout the house, there might be a problem with the electrical panel or the wiring. The same principle applies to your nervous system. Hand numbness that occurs in isolation is often a local problem that can be treated locally. But hand numbness that is accompanied by other neurological symptoms like balance problems, weakness in the legs, changes in bowel or bladder function, or cognitive changes could suggest a problem higher up in the nervous system, such as cervical spinal cord compression or even a neurological disease. This is not meant to frighten you. It is meant to emphasize why getting a thorough evaluation is so important. Most causes of hand numbness in seniors are benign and treatable. But on the rare occasion that something more serious is going on, catching it early makes all the difference in the world. I want to spend a moment talking about what you can expect when you visit a doctor for hand numbness. First, your doctor will take a detailed history, asking about when the numbness started, which fingers are affected, whether it is in one hand or both, what makes it better or worse, and whether you have any other symptoms. They will perform a physical examination that includes checking your grip strength, sensation, reflexes, and range of motion in your hands, arms, and neck. They may perform specific provocative tests, like Tinel's sign, where they tap over the carpal tunnel to see if it reproduces your symptoms, or Phelan's test, where they have you flex your wrists to see if the position triggers numbness. Based on these findings, they may order blood tests to check for diabetes, thyroid disease, vitamin deficiencies, inflammatory markers, and kidney function. They may also order a nerve conduction study and electromyography, which are tests that measure the electrical activity in your nerves and muscles to determine exactly where the problem is located and how severe it is. In some cases, imaging studies like an MRI of the cervical spine or an ultrasound of the carpal tunnel may be recommended. All of these tests are designed to get to the root cause of your numbness so that appropriate treatment can be prescribed. I also want to encourage you to be completely honest with your doctor about all of your symptoms, even the ones that seem unrelated. Sometimes the key to diagnosing the cause of hand numbness lies in a symptom you did not think was connected. For example, unexplained weight gain could point to a thyroid problem. Increased thirst and urination could suggest undiagnosed diabetes. Fatigue and mood changes could indicate a vitamin deficiency. The more information your doctor has, the faster they can get to the correct diagnosis, and the sooner you can start feeling better. Remember, your body communicates with you through symptoms. Numbness in your hands is not just an annoyance. It is a message from your nervous system that something needs attention. By listening to that message and taking action, you're taking control of your health in a way that can prevent further damage and preserve the hand function that is so essential to your daily life and independence. You have the power to do something about this, and I am here to support you every step of the way. Thank you again for watching. Subscribe to this channel if you have not already, and I look forward to seeing you in the next video where we will continue exploring the health topics that matter most to seniors. Take care of yourself, stay informed, and never stop advocating for your own health. And one final thought as we wrap up. If you have been dealing with hand numbness for a long time and you have simply adapted to it, I understand. Life is busy. Doctor visits can be inconvenient, and when something has been going on for years without catastrophe, it is natural to assume it is not urgent. But I want to gently challenge that assumption. Nerve damage that is caught early is much more likely to be reversible than nerve damage that has been progressing unchecked for years. The treatments available today are remarkably effective when applied at the right stage. Waiting does not make these conditions go away.
It only allows them to progress further.
So if this video has been the nudge you needed to finally make that appointment, I am glad. Your future self will thank you for taking this step, and your hands will be the better for it. Do not let another night of numbness go by without at least starting the conversation with your doctor. You are worth it, and your health is worth it.